So at that point we had Dr. Brown, we had infectious disease doctors, we had internal medicine doctors just coming in and out of the rooms, just trying to game plan my care because now I have COVID, double pneumonia, and I'm 38 weeks pregnant and I can't breathe. And I just kept listening to Dr. Brown's voice, like, as they're like laying me down, I'm like, I can't breathe, like I'm gonna die, like I'm going to die. Like they're laying me flat and I'm like.
Thankfully, Kristen Hutton is now able to share her story, but with a main message. She says pregnant women should not be scared of the COVID-19 vaccine. Instead, they should be scared of COVID.
They think it's not gonna touch me, it's not gonna affect me, and if I'm pregnant, I'll just stay away from everyone. Well, I was that patient, I was that person, and I got it. So they need to be vaccinated.
After arriving to the hospital thinking she just needed fluids for a stomach bug, Kristen was faced with the scary reality that she did have the coronavirus. As things escalated quickly and Kristen's lungs began failing, doctors decided to have an emergency C-section.
And I was all masked up, and I was like, oh, there's my baby, but I'm in bed and I can't see, do anything.
Baby Palmer was born safely and healthy. However, Kristen spent 8 days in the hospital, 4 of them being in the ICU and COVID ward, and had 9 blood transfusions.
It sort of showed us what we already knew. The data showed this to us, that when you're pregnant and you get COVID, you can get really, really sick.
Dr. Brown had encouraged Kristen to get the COVID-19 vaccine, but she was fearful because of all the contradictions out there. And baby Palmer was conceived via IVF, so Kristen and her husband did not want to risk a thing.
She did all the right things, right? She kept working from home. She was working from home early pregnancy, and she kept working from home. Her husband got vaccinated. Her family members got vaccinated. She was minimizing her risk as best as she thought.
But like many other unvaccinated people right now, she contracted COVID-19 and got very ill.
I wouldn't want anyone to go through this. This is horrible. It's not a good. Almost dying, not seeing your child, like first pregnancy, you have thoughts in your mind, but like never in a million years would I thought this, ever.
The data supports that if she'd been vaccinated, she probably wouldn't have ended up in the hospital, even if she tested positive for COVID, in the hospital and with severe illness. She's coming from a point of understanding the fear, of living the fear, and having a negative outcome to her, and being able to sort of speak about that. So the goal of sharing her story, of taking the time to share her story, is just to help to dispel some of the myths, just to help to address some of the fears.
For more stories like these and information on the available vaccines, visit the COVID-19 resource page and newsroom on toplinemd.com.